Well, we're glad you're joining us here on OpenLine. I'm Chuck Long here with Dr. Richard Horwat from Bluegrass Endodontics. It is Ask the Expert night. We're talking about your teeth, your gums, why you might need a root canal. A lot of things go on with your mouth. A lot of things happen, and we've had a lot of great questions. So if you do want to give us a call, time is ticking away right now, but 737-7587 is the number to call, 615-737-7587 right here at News Channel 5 Plus. Now, Dr. Horwat, one of the things we were talking about the proper care of your teeth and that sort of thing. How important is the proper care of your gums?
It is important. You know, you want to keep your gums healthy, of course. If there's a lack of brushing, your gums are going to inflame. I know that the more inflamed they are, the more they're going to harbor bacteria. Well, we spoke a little bit about calculus, and I think you mentioned tartar as well. You know, these are materials that are, these are bacteria. This is bacteria, and it's textured as well, so it's kind of like a dirt almost on your tooth. It's like a bacterial guarding ground, breeding ground in there, and you're going to want to remove that stuff. You know, you get bacteria in your bloodstream, it can cause heart problems, heart concerns, and things like this. So it is important to keep your gums healthy, for sure. You definitely want to brush them. You don't want to get them inflamed. And as long as you're staying on top of it, it's pretty easy as well. I think that when things start getting out of control, it's pretty hard to kind of get it back on track, but I think that you know, keeping it from getting out of control is the most important thing.
Well, in talking about the need to remove tartar, what causes tartar?
Plaque builds up, it forms tartar. You know, it's hard to kind of describe it. You know, essentially you have the bacteria there. The bacteria is there for a while, and it builds on top of itself. You get little dark areas such as plaque, and then the plaque kind of builds. It's there for a while, and then it just forms a really hard, bony type consistency, and it develops. A lot of times too, there's deposits in your saliva as well, and on the back of your lower front teeth, is a lot of times as a clinician, you'll look around with a mirror and you look at a patient, you'll see a buildup of tartar on the back of their front teeth, and that's from your saliva, and it just builds up over time. You know, even if you're brushing really well, depending on the amount of deposits you have, the amount of calcium deposits you have in your saliva, you know, certain people just build up tartar and calculus fast.
And then when you talk about tartar, you go into the aisles, like I said, whether you're in grocery store, Target, someplace like that, and you see all the different toothpaste, and some are for tartar control, and some are for whitening, some for cleaning, sensitivity.
Yeah, I see stuff like that, and it's mind-boggling. And even just recently, I bought some toothpaste, and you know what? I don't expect patients to be able to figure out which one's the best one for them, because I don't even know which one's the best. I think it's all marketing. I don't think there's anything special. I see whitening all over the place, and I don't see, I've used all the whitening stuff as well. I don't see my teeth getting any whiter, if I'm going to be honest with myself. I think whatever motivates you to brush your teeth, that's the toothpaste you want to get. If you just use water, you're probably going to get a favorable result just from the brushing alone. But generally, I kind of go through the aisles. I don't think any of them are special over any other ones. I mean, there's Sensodyne toothpastes that are really good for you if you have sensitive teeth, but it usually takes a little while. You have to use that type of toothpaste for a while before you get the results you're going to want, if you get the results you want. But generally, when I look at all the toothpastes on the market, I don't see any one of them being any better than the other. Just make sure it's ADA approved. I've seen a lot of them too. I know patients have even brought in different types of organic toothpastes. I wouldn't use anything like that. If it's making you feel better as a person, then go ahead and use it. But anything that's ADA approved, I'd recommend. But there are a lot of them.
There really are.
Yeah.
What about grinding? Because a lot of times you go to the dentist and they'll be checking your teeth, and they'll say, "Do you grind your teeth?" And people are like, "Well, I don't know." And they say, "Because you can do that at night." What is the grinding connection?
There are a lot of grinders. You can look in someone's mouth and you can tell they grind. I think that everybody kind of grinds to some degree. A lot of times they think it's related to stress, and or you might be overusing your muscles. And then when you go to bed at night, people have a tendency to either clench their teeth or they grind their teeth back and forth. If your dentist is telling you that you are having a grinding problem and it's causing wear on your tooth, it might be a good idea to look into getting a night guard. And a night guard is just an appliance that you can place over your lower teeth or your upper teeth, depending on your specific case. And it can help to minimize the damage that you're doing to your teeth.
Okay. And then I was asking you too, recently I'd gone to the dentist, and they're doing these pocket readings and that sort of thing. And I think a lot of times the patient's really not aware of what the pocket reading is for. You just hear these numbers being called out and that sort of thing, and I know that they're doing it probably for your best interest, but what is the pocket reading, and what is that reading?
They're generally doing what's called a periodontal reading. What they're basically looking for is that when you're probing somebody's gum, we call it what's called a perio probe. Usually you're going to about a depth of about 1, 2, or 3 millimeters, and that's considered healthy.
So if you hear them calling out the
1, 2, 3, 1, 2, 3,
okay.
It's okay. 3 is a little on the high end of being healthy, but it's healthy nonetheless. As soon as you get to the readings around 4 or 5, sometimes it's because your gums are inflamed, so you're getting a pocket reading of maybe a 5, but if you brush your teeth, your gums will shrink a little bit, and then that pocket kind of shrank from a 5 to a 3. When you get to about a 5 or even a 7, if you really kind of think about it, if a probe is going 5 or 7 millimeters underneath of your gums, so's bacteria, so's food, so's dirt and debris. When you're brushing your teeth, the bristles of your toothbrush, they're not going to go 5 and 7 millimeters underneath of your gums. Oftentimes, then that's when you need to have a deep cleaning. So when they're probing your gums, they're generally getting an idea of where your periodontal status is or how healthy your gums are, and they're kind of trying to determine which type of cleaning is best for you.
Okay.
And that's basically what they're doing.
So, just from layman's terms, the deeper they go, the worse it is.
Yeah, the higher the number, the worse it is.
Right, because they're going down deep. So, okay, well, that makes sense. Now, a little bit about when we were talking about gums and the proper care for that. Gum disease, though, I mean, gum disease is something that you want to really avoid at all costs.
Yeah, of course, you want to avoid gum disease. You know, you have periodontal problems. A lot of it, unfortunately, can be hereditary. But I don't want to blame anybody for anything. Patients come in all the time and you see, they're having problems with gum disease or they're having some type of periodontal pocketing, and they always want to use their hereditary card. And I think that bad habits are probably more hereditary than the actual gum problem is, but there is definitely a genetic disposition to it. You can have, you most certainly can have periodontal disease in your family, and that's unfortunate. But a lot of times, you want to avoid gum disease. You want to make sure you're taking care of your gums. You have gum, and one thing leads to another. When you're unhealthy situations lead to more unhealthy situations. As soon as you have unhealthy gums, it might affect how you're chewing, how you're eating. It can affect the integrity of your teeth, and then of course it can go to your heart, and it can lead to bigger problems.
Okay, well, we just got about a minute left in the segment, and then when we come back, just so you know, we will give you information on how you can contact Dr. Horwat at Bluegrass Endodontics. But the reason that if someone's just tuning in, the reason that someone first goes to see the endodontist often is a root canal.
Yes,
so, and what, do they go to the dentist first? I mean, how do they get to you? Do they call
Most of them do. We've had people come in, I've had patients come in, they haven't seen their dentist, they're in a lot of pain, and they just know that they need to go to get the root canal done. Probably would be better if they did go to the general dentist first. Sometimes when the patient comes in pain, they're coming in and the tooth isn't restorable, it's not fixable. And had they gone to the general dentist first, the general dentist could have probably told them that, and they could have avoided the trip to come see me. But for the most part, sometimes there's no pain, and the general dentist will send them over because there's some type of infection up there, even though there's no symptoms whatsoever. But more times than not, a patient is symptomatic. Something's causing the tooth to hurt, whether it's biting down or cold. And they'll send them to the endodontist. And they'll send them to us as well if they can't figure out what tooth it is.
All right, we'll take a break and we'll be right back right after this.